and Tobago was called into action several weeks after major cities around the world began recording increased COVID-19 cases. Our ERHA, and I say our ERHA because it includes our stakeholders and everyone, made preparations to receive the first 68 nationals from the Fabulosa cruise on March 17, 2020, after the closing of borders. We started the first quarantine facility, leading the national response along with the Ministry of Health for the COVID-19 pandemic. We then started the first step-down facility in Brooklyn, and I locked horns with the chairman of the corporation at that time because the public could not understand COVID-19, all right, and felt a sense of threat. So even though we had engaged, they still felt that sense of threat. And fortunately, after discussions with the chairman of the corporation, all right, he supported, all right, and we surmounted that, and we were able to take care of our people. The second quarantine facility was at the Tacarigua Racket Center, and the second step-down facility was at the Tacarigua Extended Care Unit, and the first mass vaccination site at the Tacarigua Racket Center. So that tells you what the Busy Beavers have been up to in terms of scoring goals. Number of persons that have been housed in COVID-19 facilities, 290. Number of persons housed in step-down facilities, 165. And the number of persons who we vaccinated, 159,358. Let me just tell you a little bit about the journey for us. Incidents, meaning from the first cases, all right, treatment, where we had the step-down facilities and so on, and control, where we had our vaccination program. We based our modeling, all right, because it wasn't just a reaction. We planned and we modeled. We based our modeling on the pillars of our vision in the ERHA, looking at shared vision so that everybody in the ERHA was engaged so they understand COVID-19 and its implications. All right? Focused also then, people focused, staff, clients, communities, MOH, and the RHAs. So our emphasis was on all of those. We took care of staff, we took care of clients, communities. The MOH we worked with closely, and we partnered with our fellow RHAs. And comprehensive quality care, we sought to have systems of care with our infection control and prevention models and so on that were appropriate, safe, and satisfactory during that time. Strategic approach, leadership. As I said, it was based on the pillars of our vision, all right? And what we did is we considered this a disaster, and we engaged our disaster management team coordination model at the EOC at Picton Road, and from there we ran the response. Some of our managers are probably smiling as they recall the 3 a.m. visits on the road to some of these facilities to ensure coordination and success. We also had sub-EOCs, emergency operating centers, at the 2 CMOs, St. Andrew, St. David, and Nariva Mayaro, and at the hospital, all right, under the HMD, and all of them were staffed by the management teams. Commitment to excellence, and we talked about the first being staff and peoples and so on. So we had 100% staff education on COVID-19. We had staff quarantine after management facilities to reduce fears and confirm health status. In other words, when we started the quarantine centers, we didn't even have to request staff to go. Staff volunteered. And that I called the ERHA spirit. So that when staff served a rotation at a quarantine or other facility, we then put them into quarantine to ensure that they were all right before reintroducing them to family and work and so on. Improved staff and health connectivity. We had stress management, increased sessions for employee assistance program, staff consultations to support and re-engineer, nutrition lectures, mental health lectures, and we did this kind of thing not just for staff, but for the patients at the facilities. Many of the patients at these facilities would have celebrated birthdays and so on, and we virtually joined with them. We would have sent up cakes and virtually, just to make the experience of this unknown illness and its dark threat, because so much, we were hearing about it, to make people more comfortable. Our first, the Balandra facility was based on an environment of sun, sea, and sand up at Balandra. In other words, the fresh air and breeze of the sea having a curative effect upon our clients. The second facility, was in Brooklyn. And that was developed in a country-style background in Brooklyn, not Brooklyn, New York, Brooklyn right here, at what used to be a home for elderly people with gardening, etc. facilities, so that people could walk out and enjoy, the country atmosphere and that type of thing. We even had laundry facilities so they could do their own laundry, that type of thing. That's at the Brooklyn facility. So we would have encountered some feedback at some point, but we know we provided a high quality environment. Tacarigua facility, this was again physical activities such as tennis, walking, and recreation at that big facility there. All right. And I just want to say that recognizing that staff would have been facing this unknown and so on, we spent quite a lot of time ensuring that the protective equipment was there in stock and available for all our staff, all right? And we adjusted and ensured a regular supply for all our facilities to ensure the protection of our staff. We had infection prevention and control training for all frontline staff, implementation of international models of hot and cold zone operations to ensure safety. So when you're working in the hot zone, that's where the COVID patients are. You have certain standards, and then you transition to the cold zone, which provided the transition for you to leave the facility or leave the ward at that time. All right, some pictures here of our staff, all looking like Martians and so on. All right. Commitment to staff morale, we did quite a lot of that, all right, to keep staff going and keep staff, because I used to call some of our managers two hats, where you had to operate whole day looking after COVID and then go home, change your hat, and become the school teacher to your kids, all right, and the housewife and the house husband, etc. So I used to call us two hats. But we tried our best to meet them and to do what we could to ensure that our staff was as comfortable as possible. We did our communication strategy where we kept staff in charge, in touch with everything. We had our ERHA hotlines, we had our social media interventions and so on. Commitment to staff morale and encouragement, we went all the way to try and boost our staff and to boost our clients as they enjoyed what was in fact a threatening experience. That slide showed some feedback, good news from our clients, some acknowledgements. And then we moved into vaccination. Vaccination sites, mass sites, Racket Center, Sangre Grande Civic Center, Mayaro Sports Facility, Sumer Singh Sports Complex, Brooklyn Community Center, Sangre Grande. And our main vaccination sites at health centers to include Grande Enhanced Health Center, Toco Health Facility, Rio Claro Health Facility, as well as our health centers. So I was provided with some figures, all right, that we had 11 community vaccination caravans. You all would have seen us moving from Matlot coming down the road, all right, on foot, village to village, door to door, giving vaccines to our people. And vaccination outreaches under shops, parlors, schools, market, etc. We did 135 of those sessions, all right, to ensure that we did our tour with vaccination. Number of people housed, well, we saw this slide before in terms of the quarantine facilities and so on. So that was COVID. And as I said, I thought it best to highlight that response because that response came, as I said, at a very challenging time. And I want to publicly acknowledge our teams, all our staff, for what they had been able to achieve. I want to acknowledge the public for cooperating with us and, moving along with us as we traversed the uncertain ground of COVID-19. Let me, in closing, encourage that the ERHA now, as we're coming out of COVID, we have started a re-emphasis on our chronic disease programs, our CNCDs. And we will be having soon a large symposium to go through primary care and to think about the pillars of primary care that we need to enhance and change and do things differently so that we can, in fact, impact the community. But we need to emphasize to the community, as a matter of fact, in our recent public consultations, one person in a particular village area said that they were concerned about the industrialization in the area and explosions and so on. And I was telling that person, listen, our ODPM and our agencies have plans in such areas to control the after effects of any of those kinds of disasters. So I want you to focus not on that explosion, but on the explosion that is coming to your doorstep in terms of poor lifestyles, in terms of chronic non-communicable diseases, as we look at what is happening in our society with cancers, diabetes, heart conditions, mental illness, and so many other things. So I want to invite our community to walk with us as we refocus to be able to strengthen, support, encourage, and move more into prevention, all right, as well as rehabilitation and so on at a primary care level to ensure the continued health, not illness, but health of our communities. Thank you very much.